Hi everybody, it's Dr. Magnifico from prebred.com. This little guy is Simon. He's almost a year old. He is a Brachycephalic. He's actually a Himalayan. So he has got a flat nose, a flat face and a short nose. He kind of snorts when he's up and breathing normally. So he got neutered today, and I wanted to go over some of the things that we do differently for Brachycephalic, especially cats. He was pre-oxygenated, meaning we've had him on oxygen. So he's hyperperfusing his red blood cells with oxygen. So he's been getting lots and lots of supplemental oxygen beforehand. He's just starting to wake up now. So yeah, so his heart rate's getting a little fast. He's been on oxygen for about 5 or 10 minutes before his surgery, and we did a full exam on him. He's had pre-op blood work to make sure everything's normal. We made sure he's got 2 testicles in the right place, which he did. We talked to his mom about things that we wanted to do pre-operatively and post-operatively. So some of the things that we did pre-operatively, like I said, we gave him some oxygen beforehand. That makes sure that he's got lots of reserve oxygen in his system, so that if he's having any trouble breathing, or if it takes us a minute to intubate him, he's got some extra reserves. We also put a tube in. We don't always intubate cats for their neuters, but any of these guys that might have any predisposing anatomical factors or medical factors get intubated. So he got intubated, meaning we've kept him on oxygen and isoflurane anesthesia for his neuter. He had a routine neuter, which only takes a couple of minutes, and then we are keeping him on oxygen, and I'm staying with him while he wakes up. I'm making sure that he's got an open airway, so the tube's going to stay in until he's up and awake, making sure that he doesn't have any problems with his breathing. Brachycephalic animals have difficulty because they have a very long, soft palate, so that closes off the back of the throat. They have a short nose, so that makes it even more difficult for them to breathe, and oxygen is always an issue with them. The cost of a neuter here for a cat is only $60. He's going to be a little more expensive because we pre-oxygenated him and we intubated him. But it's really only going to add 20 to 40 bucks on top of his stuff, and really making sure that he gets up and awake and out of anesthesia is the most important thing. So he is just starting to wake up. He's starting to move and react to my hand. I've got an oxygen sensor on him, so I know he's getting enough oxygen and his heart rate's staying normally. And he did great. So if you've got one of these high-end specialty breed cats, you know, a Himalayan, a Persian, any of those guys that already are predisposed to having any breathing difficulties, talk to your veterinarian about what a neuter is going to entail. I absolutely think that pre-oxygenating them using a very safe anesthesia drug, keeping them on inhalant anesthesia and staying with them the whole time from start to finish. So from the minute we start pre-oxygenating him to the minute we take his tube and he's up and awake is imperative. You're not going to get this kind of help and assistance at a high volume spay and neuter clinic, so these guys really need to be in the hands of the veterinarian. He also got microchipped today, and he's up to date on all his vaccines, and we, of course, trimmed his toenails. So he's starting to wake up, and he did just great. If you have any questions, you can find me anytime at Jared's Full Vet or on prebred.com. Take care. Bye.